So getting the right therapy on board up front is, I think, the primary challenge, and it's the holy grail. So people often think of antimicrobial stewardship as something that's very restrictive. They often see the antimicrobial stewardship program as the antibiotic police. But the truth is that antibiotic stewardship is focused on the right drug at the right time. Whether that is a broad spectrum or narrow spectrum agent is really besides the point. The patient is the focus, and the goal is the same: optimize management to optimize outcomes. And we really need to break down that silo to recognize that stewardship is a part of the sepsis protocol and vice versa, not really one without the other. Unfortunately, antimicrobial resistance rates continue to grow at an alarming rate, and we are seeing that across the board with respect to infection types, whether it's drug-resistant urinary tract infections, pneumonias, or sepsis. Resistance is certainly something that's here to stay. Stewardship programs are very well equipped to help provide context to empiric treatment recommendations for sepsis protocols by measuring and monitoring local trends in resistance patterns. Sometimes this can be particularly helpful in special patient populations like immunocompromised patients or pediatrics or the elderly. So I think that there's a lot of room for collaboration in the regulatory space around sepsis and antibiotic stewardship. Both stewardship programs and sepsis protocols are, for the most part, federally mandated programs in their own way. Yet I often find that institutions fail to make that connection. Quality indicators for stewardship can really help to inform sepsis management strategies in the hospital setting, and they can really do a nice job complementing one another. And these relationships are best served on the local level. So I would really advise a lot of hospitals to get with their quality management team as well as their ICU teams to get together and come up with strategies that will better inform the management of sepsis. Really working together to ensure that patients receive the right therapy up front as soon as possible, and then tailoring treatment once more information is known. So being aggressive up front and then really being sure that you close the loop and de-escalate in a timely manner. On a daily basis, pharmacists can help really follow up with these patients throughout their hospitalization to optimize their anti-infective therapies. And then on the larger scale, I think that stewardship could certainly be at the table when it comes time to review those empiric sepsis order sets and guidelines. Their role in this space is really invaluable. Stewardship teams can really help sepsis management by detailing patient risk factors for resistant infections, as well as help to ensure that rapid diagnostics are acted upon in a timely manner so that we can actually really exploit their value as opposed to, waking up and seeing that result the next day. Faster turnaround time, hands down. I mean, it really allows us to have far more sensitive testing. You barely need to have any organism to be able to detect it and identify the causative pathogen so that we can get treatment on board as soon as possible. So again, really the big advantage here is going to be faster turnaround time. So that PCR test is going to tell you exactly what you're dealing with. And then once you've started tailoring your treatment towards that type of organism, those antimicrobial susceptibility testing results can really help you to tailor and optimize the drug that you end up giving your patient for management of their infection.